I am Wickremasinghe and I will be presenting the study Automatic Detection of Extracardiac Findings in Cardiovascular Magnetic Resonance. This study aims to benefit from the ongoing increase of importance of CMR as an image modality, and in particular it will focus on the A.I.L sequence of a CMR acquisition, which is a scout sequence routinely acquired as part of a CMR exam. CMR is a valuable image modality and has many advantages, such as its accuracy, non-invasiveness, and the fact that it doesn't expose patients to ionizing radiation. Another important feature is its large field of view, which allows to scan a wide portion of the human body. Starting from the A.I.L sequence, this study aims to automatically detect potential unknown health-related issues, and in particular, it will focus on the detection of extracardiac findings, which can be defined as extracardiac irregularities that may require further investigation, follow-up, or treatment. Currently, the extracardiac findings are manually inspected by trained radiologists, which causes a burden on the clinicians, and some of the extracardiac findings may be also missed. The importance of investigating extracardiac findings has been proved in previous studies, which showed that there is a poor prevalence of 35% of extracardiac findings in patients undergoing a CMR exam, with 12% of the extracardiac findings classified as major, hence requiring further investigation. The assessment of the extracardiac findings is important both to detect potential unknown diseases, but can be also useful to determine the primary cardiac pathology, as many cardiac conditions have a multisystemic environment. Therefore, this study aimed to automatize the detection of the extracardiac findings through the use of deep learning classification methods. Here, an overview of the employed framework can be seen. The first step was to convert the A.I.L sequence images from DICOM format to Nifty arrays. Secondly, a pre-processing step was carried out to convert the data before feeding it to the networks. The main task was then divided into two subtasks, which were framed as a binary classification problem and a multi-label classification problem. The first one aimed to detect the presence or the absence of the extracardiac findings in the data, while the second one aimed not only to detect the extracardiac findings, but also to classify them based on their location in the body, particularly in the neck, lungs, mediastinum, liver, kidney, abdomen, soft tissue, and bone. This task was framed as a multi-label classification task because some of the data may present more than one extracardiac finding, and therefore the network needs to be able to assign multiple classes to each piece of data. To perform both classification tasks, 7 state-of-the-art classification networks were employed. As mentioned before, one of the first steps of the employed framework was the pre-processing step, to prepare the data before the training phase. This consisted in a resampling to an in-plane voxel size of 1.25 per 1.25 mm and a subsequent cropping to a standard size of 256 per 256. Next, the dataset was split so that 80% of the data was used for training and validation, while the remaining 20% was used for testing. The data was split so that images from each patient were bounded to a specific set to ensure data independence. During the training phase, data augmentation was performed on the fly to account for the limited size of the dataset. Lastly, the performances of the networks were evaluated through the computation of sensitivity, specificity, positive predictive value, negative predictive value, and balanced accuracy. To perform the detection and identification of the extracardiac findings, data acquired from 236 patients was used, which resulted in 5,510 slices, and a total of 746 extracardiac findings were found. The image at the right shows the distribution of the extracardiac findings in the data for the binary classification, while the image at the left shows the distribution of the data between the 8 classes employed for the multi-label classification. In this table, the results obtained for the binary classification task can be seen for each of the employed 7 state-of-the-art classification networks. The best performing network was BGG, which obtained 55% sensitivity, 76% specificity, and 66% balanced accuracy. In the second table, the results obtained for the multi-label classification task can be seen for the 7 state-of-the-art employed classification networks. In this case, the metrics were computed following two conventional methods, micro-averaging and macro-averaging. Micro-averaging computes the statistics from the total number of true positives, true negatives, false positives, and false negatives, while macro-averaging computes the metrics per class and then calculates their average. For the multi-label classification, the best performing networks were AlexNet and ShuffleNet, which obtained sensitivity higher than 41%, specificity higher than 83%, and balanced accuracy higher than 62%. In this image, some visual examples of results from the multi-label classification task are shown. It can be seen that the size, shape, and location in the body of the extracardiac findings is very different between different classes and within the same class as well. It is also worth mentioning that the reported examples of missed extracardiac findings are very small in size, which would make them harder to identify. This study aimed to use deep learning methods to automatize the detection and identification of extracardiac findings from the Hayes sequence of CMR acquisition. The current results need to be improved to allow for employment in clinical settings. In particular, the low sensitivity needs to be addressed and increased to the highest possible levels. The low sensitivity obtained in this study can be caused by different factors, such as the limited amount of training data and the multi-vendor nature of the data, the large variation in size, shape, and location of the extracardiac findings, and the large class imbalance. In our view, the reduction of the number of the false negatives is more significant than the reduction of the false positives, as these can be easily discarded by trained clinicians, while a high number of false negatives means that many extracardiac findings are missed. In conclusion, the classification task obtained promising results, proving the feasibility of employing deep learning methods for the automatic detection and identification of the extracardiac findings. Future work will aim to increase sensitivity, which is important to ensure that no extracardiac findings are missed. A larger and more representative dataset will also have to be used to improve performance so that each class is equally represented. And lastly, future work will also aim to carry out major-minor classification of the extracardiac findings. This consists in classifying the extracardiac findings based on their severity, which is important to select which findings require treatment and which ones can be considered benign and therefore discarded. Thank you for your attention.